all. This is Dr. Mobeen Sayed from drbeen.com. Sorry for starting a little late. Welcome everyone to the discussion. Let us start our talk. So a quick synopsis of what we are going to discuss. Number one, we're going to discuss about Dr. Bruce Patterson and Dr. Yeo been working together for a protocol for long haulers. So I'm just going to give you a little bit of an idea for what they are doing and what they are looking to do further. That is one. Secondly, I'll give you an update about the patient I've been talking about who was admitted in an ICU in New York for about 4 or 5 months now, and his current state. Then we'll talk about a few things that are very interesting. We'll talk about EGCG, which is part of the green tea, and an experiment that shows it to be a zinc ionophore. So the excuse me. So the takeaway is that EGCG is a zinc ionophore. The second thing that I would like to discuss is let me just very quickly see my topics here. That is there is a nasal spray called INA 051 by an Australian company. That nasal spray causes our innate, so they've done an experiment on the ferrets, not on humans. But what it does is that in our nasal area, it reduces the viral load when we use that thing as a nasal spray. So what they are saying is, and I'll explain the mechanism, that INA 051 acts as an innate arm booster, but within this area where we spray it. So that really makes us, or our innate arm here in this area, look similar and behave similar to a children's innate arm here, and kind of helps us be protected the same way. So I thought that is a very, very interesting idea. Remember, we've been talking about how do we boost our innate arm to be similar to children without causing too much damage. So this is one of such options. And my request would be that please share this video, because more people can probably use this. It can be life-saving. And the third topic that I want to discuss today is the bradykinin storm. Remember, we talked about it. So there is a study, very small study, which used bradykinin receptor blocker to see that if we try to block the bradykinin storm, what will happen. So they saw very good results. So these are the 4 or 5 talks that we will do. I'm going to share my screen and we'll start. Good evening, everyone, and good morning and good day. So you might see me coughing a little bit again today. There was another fire over this Sunday evening, where there was a winery that caught fire, and there was 11,000 acres of fire that is burning now again in north. So once again, some more irritation for throat. I hope people are safe. All right, let's start. So green tea, which is some folks' favorite tea. I love green tea as well. Green tea has EGCG in it, and that is Epigallocatechin-gallate. So Epigallocatechin-gallate. That is a plant polyphenol. It is very similar to quercetin as well. Quercetin is also a plant polyphenol, and EGCG is also a plant polyphenol. The question that was interesting was, so these both, or plant polyphenols, are antioxidants. They take part in the signaling molecules as well. They have been seen to be anti-cancer as well. We are talking about COVID-19, and we are talking about zinc ionophore. So there is an experiment where the researchers showed that these substances can actually be zinc ionophores. So let's look at that paper quickly. Again, all links are in the description. So here, zinc ionophore activity of quercetin and epigallocatechin-gallate from HEPA1 to 6 cells and liposomal model. So this is that basic discussion here that they've done. I'm going to show you what they have done here. So this is what they did. It's really fascinating. I love it. I love researchers and how they do their function and how do they think about what to do. So imagine that this is a mouse hepatocyte or mouse liver cell. And it is a hepatocarcinoma. That means it is a cell that is a cancer cell. And why do they use cancer cells in some of these researches? Because cancer cells are hardy cells. They're not going to die. They've learned not to die. So they're easy to culture and they're easy to replicate and they're easy to keep in the lab environments. So they have mouse cancer cells, plus they built liposomes. So I hope that we know there are so many technologies that now use liposomal things. So liposome is nothing but a particle which is lipid particle. Inside that lipid particle, they have cholesterol. In this specific case, they have filled this with cholesterol. Plus, what they did was, in this particle, this liposomal particle, which is an artificially created lipid particle, these red ones over here are special markers. You can say they are enzymes, which when combined with zinc, they would fluoresce or they would give light. So this is their experiment. On one end, they have the mouse liver cell. So here is zinc. Zinc, we know, has two positive ions or two positive charges on it. Because of that, zinc cannot easily, or it cannot enter the cell. Because the cellular membrane is made up of phospholipids, and these are neutral substances, lipids, and so any charged molecule cannot pass through that membrane. So any charged molecules are just going to sit outside until we provide them a channel to go in. So here is zinc sitting out there. Here is zinc sitting out there as well for the liposomal substance too. And so what they did was they put them, zinc and the liposomal substance or liposomal particle, and zinc and the hepatocarcinoma cell of the mouse, and they observed if the zinc could enter the particle and the particle would fluoresce, and they saw that this did not happen. That means zinc by itself could not enter the particle and connect there with this marker for zinc, which if the zinc would come in, it would connect with it would bind with the zinc and it would fluoresce. So they saw there was no fluorescing. So then what they did was, here, they wrapped zinc in the quercetin, or they put zinc together with quercetin and EGCG. And then they put that in the same culture once again. And this time what happened was quercetin and EGCG, and they had one more substance, they all took zinc with them. So as we say, they chelated zinc. What does that mean? They bound zinc and kind of hid its positive charges. So they kind of hugged it. And when they bound with the zinc, when they chelated it, now zinc became neutral with them. And then they act like a ferry and bring the zinc inside the liposomal particle or inside the cell. Once inside the particle, we know that they had set up the particle in a way that inside the particle was that marker, which when combined with zinc would fluoresce. So now when they looked at it, after putting the quercetin and EGCG, the particle started fluorescing, which meant that zinc had entered the particle. So they say that this is the first time they have proved that through a liposomal particle, that zinc can be chelated by quercetin and EGCG and it can go into the cells. So the takeaway here is that we should take more green tea. So quercetin is one, green tea is another, and there are other zinc ionophores as well. So that is one important takeaway here. So let's look at their study very quickly. So what they're saying is only the combinations of chelators with zinc. So chelator here are the quercetin and the EGCG, triggered a rapid increase of FluoZin 3, that is a marker for zinc, which was present inside the liposome, fluorescence with liposomes, thus demonstrating the ionophore action of QCT, EGCG, and CQ on lipid membrane. The ionophore activity of dietary polyphenols, that is the plant polyphenols, may underlay the raising of labile zinc levels triggered in cell by polyphenols, and thus may be of their biological action. Labile zinc mean the zinc that has gone into the cell and now is connected with some proteins and is doing its functions. So there's a question by Carolyn. I have seen zinc chelate. Is that good? Does it do away with the need for an ionophore? Yeah. So as long as there is a chelate which we can take with zinc, then that is going to work. That is the same thing with the liposomal zinc as well. So there is liposomal zinc as well, which would act as a chelator and then take it inside the cell. So yes, Carolyn. Very good. So that is one. Now, very quickly, I also wanted to discuss a couple of things. So number one, I think it's a good news, and that is that Dr. Yo and Dr. Bruce Patterson are working together. And again, I do not know the exact contract or exact working relationship, but what I know is that they're working together to figure out that what is happening in long haulers. So for that, Dr. Patterson and his company has created a testing kit. So if you are a long hauler, they can send you a kit, which of course you need to draw your blood and send that back to them. And then with that kit, they can figure out if you have interleukin 6 or interleukin 8 or tumor necrosis factor or some other immune modulatory cytokines that are present and are still present in the body. So that is a good one. They had asked me that if any of our cool beans or patients of mine, if they would like if they are in long hauling state and if they would like to be tested. So if any of us want to be tested, please tell us, and I would connect you to Dr. Bruce Patterson and Dr. Yo. So that is a good news. My own experience, I had been tweeting over this weekend. Majority of my patients who went into a long haul state, they were cured by using a pulse of steroid. There was just one case in which this was a patient who had cancer as a comorbidity as well. In his case, I gave them, so 2.5 months after recovering from COVID, he still had symptoms and he had gums inflammation and an inflammation in an area of shoulder surgery. So I started them on one pulse that improved a little bit, but not much. Then I gave them one more pulse, and now he is the last message I got last week was that 90% improvement has occurred. So so far, the methylprednisolone has been working very well, at least in my cases. So that is one news. The other news is the patient. Maybe you remember about 3 or 4 months ago, maybe a couple of months ago, I had been discussing a friend's brother who was in New York and was admitted in New York hospital for COVID and ended up on a ventilator and in an ICU. He had been fighting COVID, and last night they called me that he had passed away. So that was a sad situation. He was 46 years old. He had a comorbidity of diabetes. The thing, there are so many people who are dying, and so sometimes we become separated from all of that, and these things, these tragedies that just become numbers. But of course, when it happens close to you, this is the second death within my close relationships that I'm seeing, or friends that I'm seeing. In this particular death, why I'm upset, and I had talked about this before as well, and that is that this person, this friend's brother, when he developed the symptoms, he started, remember there was a post which somebody had, of course that was a fake post, where they had said that Stanford doctors say that you should have steam, and then some Japanese doctors say that you should sip hot water, and that hot water would bring the coronavirus in the stomach and it would be destroyed over there, and that is the way to. So this brother of this person who's my friend, when when he talked about his brother going to the ICU, he said to me look, he had been managing himself at home. And I said, how was he managing himself? And he said he was taking steam, and he was he was sipping hot water as the post had said. And then it just kept becoming aggravated to a point where he could not breathe correctly. And so then he called 911 and they took him to the hospital. So how many lives has that post taken? And how many lives, how many people has that person or persons who put that letter together they've killed? This is a death very near to me, so I could see it and I could see why this happened, that he became so aggravated. So that post, I still feel that the writer of that post must have been so excited that my post is viral. But how many people he has killed, I cannot even imagine that there are immoral people like this. We cannot expect everyone to know what is right. We cannot have, let's say that if over here at Drbeen we are offering things that are correct, not everyone knows it. Not everyone will ever know this. It is impossible. So we cannot expect people to know what is the right thing. But such evil elements that pop up during such stressful times and difficult times, and then they do this, I cannot imagine what kind of people are these, the ones who wrote these kind of posts. So anyways, I'm going to continue. That was the sad story of that patient. Here, this is another one. So the thing that, so Daniel Train is saying which post was that. Daniel, in the beginning, about 3 or 4 months ago, there was a post that became very viral on WhatsApp and on Facebook. And I did my first video in COVID series was actually to debunk that post. That reading that post made me create the videos for COVID-19. I used to do other medical teaching videos before. When somebody forwarded that to me and said, I still remember, it was forwarded to me by a friend of mine, and he said, I'm going to share it to others. Can you verify as a doctor what is written in here is correct? And when I read that, it was such a disaster. So I responded to my friend and I said, please don't share. And then I did the very first video in COVID-19 series where I said, debunking the social media post. And funny thing is this, when I did that video and I posted it on Facebook and YouTube, Facebook actually banned my video, saying that you are wrong and you are doing things or saying things that are incorrect, and kept the other post up. So I reached out to Facebook and I said, that post is wrong. I'm trying to debunk this and you have just blocked my post. And then they let it go. But that was a post. In that post, somebody had written few points for how to know that you have COVID-19. Remember, hold your breath for 15 seconds. And if you cannot hold it, you have COVID-19. And then if you have COVID-19, sip hot water and take steam. So whoever was the author of that post has definitely killed people. This is one of the person in my own friends circle who died because of that post. So back here, intranasal toll-like receptor 2 agonists. So what is this discussion? So remember a couple of days ago, we were talking about children have a better immune system. They have a better innate arm. Then we did a video about how do we have a stronger innate arm. Here, this is another chance for us to look at how the innate arm in adults could actually become better. So there is a company in Australia, I believe they are called ENA Enterprises or something, but their name is ENA. That company has been making toll-like receptor agonists. And what does that mean? So let's very quickly look at it. What happens is, if you look at this brief overview of our immune system, I think you can recognize majority of the things over here. We've been talking about them. This is a neutrophil. This is a, what is that? I forgot its name. This is a macrophage. So I sometimes, when I'm upset, I start losing words. So this is a macrophage. And this was, what was the cell that looks like an it's star? Anyways, so these are all innate arm cells. Then inside our nose, of course, we have epithelial cells as well. Correct? Then we have the immune system cells. For example, we have T helpers, which are T helper 2, T helper 1, T regulatory cell, and then we have B cell, and then we have cytotoxic T cells, correct? We've been talking about these for some long time, and we know these. All of these cells have toll-like receptor. These are receptors present in the cell to connect them to antigens. So that may be a virus or a bacteria or a fungus or some other antigen. Antigens have patterns on them, and I did a discussion about how do we recognize those patterns or our system. That video is phagocytosis. So here what happens is when a pathogen enters our body, so let's say nose, here is a pathogen, this is a coronavirus, it will connect with the epithelium through toll-like receptors, and it would connect with the immune cell as well through toll-like receptors. Yes, absolutely. Carolyn, thank you very much. So this is called a dendritic cell because it has dendrites. Can you imagine? I'm so angry about that post that I forgot that this is called dendritic cell. Anyways, so thank you, Carolyn. So dendritic cell is sitting here and it has toll-like receptor, and toll-like receptors help the cells to bind with the pathogen. Then they become activated, and this is innate arm. What they did was, this company, what they did was that they used ferrets as a model. This is not an inhuman study. This is a ferret model. They took some ferrets and they made them, first they sprayed a nasal spray in them, which allowed the toll-like receptor 2 and toll-like receptor 6. There are many types of toll-like receptors. So toll-like receptor 2 and 6, their drug or their nasal spray connects with these receptors and stimulates them. It kind of acts like an antigen binding with them. So when these toll-like receptors are stimulated, that causes the cell to become activated, and the activated cell of the innate system, when it becomes activated, it starts releasing cytokines and chemokines and other things. Right? So this is the basic idea. What they had done was this particular drug, the drugs that are for the toll-like receptors, many times they're not very much useful because when you give them, they would start the innate arm and activate that. That would cause inflammation, which itself is bad. So the result is this kind of drug is not very common and is limited in its use because it can actually trigger the immune system. But here they have found a very interesting use. What they are doing is they are saying that we have this INA 051 as a nasal spray. So it is only going to be in the nasal area. It is not going to be absorbed systemically. It is not going to cause inflammatory dysregulation throughout the body. It will not, for example, it will not activate innate arm everywhere. Secondly, there is a problem that when you activate toll-like receptor 2, for example, toll-like receptor 2, when you activate that, it causes interferon type 1 to be released by the activated cells. And that causes immune system dysregulation or overactivation. What they found was that if you stimulate toll-like receptor 2 and toll-like receptor 6 together as a heterodimer, then the resultant activation does not have interferon 1 release. So immune system does not become dysregulated. It becomes active, but it does not become runaway. That is one. Secondly, they found that when you use toll-like receptor 2 and 7, then T regulatory cells become activated as well, which means what? T regulatory cells function is to regulate the immune system. So once the toll-like receptor stimulation would cause the immune system, innate system to become active, then after some time, T regulatory cells would come in and say, all right, you can stop working now. So it would kind of calm it down. So it would activate the system without the harmful interferon 1, and then it would suppress the system as well. What a beautiful mechanism. And somehow they had not found utility for this before, which was very, so they had a limited use. So going back here, what they did was they use this. So if I show you, this was their study. And what they did was they used the ferrets to do the study. Let me show you the results of their study. Results are the following. And these are pretty interesting results. So they gave 2 doses of nasal spray to ferrets, and then they challenged the ferrets with the SARS-CoV-2. And what they found was, I think this is, you'll be blown away with this, there was 24-fold reduction in viral load in the upper respiratory tract, especially throat, and 15-fold reduction in viral load in the nasal area. What that means is about 93 to 94% of the viral load was controlled by the nasal spray. So what they're saying is, they're saying, number one, use this nasal spray as a prophylaxis. Use this nasal spray that when somebody is using it, and if they are sick, their viral load in this area is going to be low, so they would be shedding less, which is excellent. They're saying use this in conjunction with the vaccines as well. Vaccine take anywhere from 4 to 6 weeks to become active, because when we take a vaccine is going to be entering our body. That would cause the innate arm to become active, then the adaptive arm to become active. And we know that adaptive arm would take some time, anywhere from 7 to 14 days or more. And vaccines would need booster doses as well. So maybe if the vaccine dose is given, first dose is now and then 30 days later, then it is possible that the optimal response from the body would appear in 1.5 months. So what do we do during that time? And they're saying you can use this nasal spray during that time. So I really love this idea. So look at this. Innate, what are the benefits of this nasal spray? Innate arm priming. That means the readiness of the innate arm in the respiratory epithelium, upper respiratory epithelium, and activation. Then reduce shedding. So of course, when the innate arm becomes activated, this arm, when these arms become activated, like we discussed with children, then what happens is that this arm does not become overactive, and this arm would take care of the virus right at this point. I love it. So reduce shedding, because innate arm is working, the viral load is not increased, and so person is shedding less. So transmission is less. Prophylaxis. So let's say this nasal spray is taken twice a week. That is a good prophylaxis. And it keeps the viral load low as well. I think that gives our body a chance as well to develop immunity to the virus with the lesser load. So this is going to be that asymptomatic. So now those patients who may actually be prone to overactive immune system, if they're using this spray, they may actually end up being mildly symptomatic or asymptomatic and recover just like children do. So this drug is not in trial yet. I saw a comment there. They just had this discussion. They just did this experiment. Then other antivirals. So what they did was they compared their drug's effect to other antivirals as well. And they saw that when other antivirals are given, these would be either not reducing the viral load at all in the upper respiratory tract, or in one case, one drug caused 4-fold reduction. That 4-fold reduction was still enough to cause shedding and transmission. Then the nasal spray has an immediate response. So as soon as you do the spray, there is a response right away. Then this is self-administration. You don't have to go for vaccination and injection and then a follow-up dose and all that. You have the nasal spray at home. It is cheap. According to them, it is actually easier to manufacture and have it. Then it does not have systemic absorption. So all of these things in theory look amazing. And I know that Toll-like receptor 2, we use that for hereditary angioedema. Actually, we use that for immune dysregulation things. So Toll-like receptor 2 plus Toll-like receptor 6 activation is actually a very decent idea. So I'm just going to very quickly go over what they have, and then we'll continue with our last topic for today, and that will be the bradykinin. So if you see here, this is the discussion. They're talking about toll-like receptors. There are multiple kinds of toll-like receptors. The important thing is that their nasal spray works on toll-like receptor 2 and 6 together, which prevents some of the bad immune dysregulation issues. And then in terms of their results, if you see here, I think this is the takeaway, the green one. After 5 days post-exposure to SARS-CoV-2, INA-051 had statistically significant reduction of virus in throat swabs, and power is good as well, with 24-fold reduction, 96% reduction, and nasal wash, power is slightly different, 15-fold or 93% reduction in this group compared to untreated animals. So, love this idea. And finally, the bradykinin storm and bradykinin receptor antagonist. I did not have a chance to draw this, so I'm going to use my previous video to show you the mechanism and then speak on top of it and explain what this is. So let's first look at it's a very small study or observation. So what they have done is, considering that bradykinin storm is a possibility, they wanted to block the B2 receptors. Excuse me. B2 receptors are the target for bradykinin. So bradykinin storm occurs through the B2 receptors. What does that mean? So if I can very quickly show, this was my original video about bradykinin. So I'm going to use this, this mechanism. So if you see here, what happens is we have high molecular weight kininogens or low molecular weight kininogens present in our tissues, either in the blood vessels or the tissues. Then on, on these kininogens, kallikreins act. And there are tissue kallikreins and there are plasma kallikreins. These are enzymes that would convert kininogens to bradykinin. Bradykinin, in turn, will create nitric oxide, number 1, prostacyclin, number 2, and then EDHF, or endothelial-derived hyperpolarizing factors. All of them together cause vasodilatation. When the vessels dilate, that causes local congestion, especially in the lungs, and that makes breathing difficult because now lungs are filling with fluids. The other problem is that, remember in this bradykinin discussion, we had observed that the researchers found that ACE enzyme, that is in the middle of the screen here, where it says 2, that is the ACE enzyme. ACE enzyme's function is to take angiotensin 1 and convert it into angiotensin 2, correct? So that is the angiotensin side. ACE enzyme's function is also to neutralize bradykinin. But in SARS-CoV-2 patients, ACE enzyme is reduced. That is the observation by the computer. When the ACE enzyme is reduced, that means neutralizing the bradykinin or destroying the bradykinin in our body becomes less, because ACE enzyme is not functioning correctly or is not present in the right amounts. That causes increased bradykinin, which would then cause bradykinin storm. So what they did was, they said, why not we take bradykinin and take the receptors on which it works to cause its effect. Why not we block those receptors? So I'm going to just very quickly draw that part. So here is bradykinin. And so this is the bradykinin. Bradykinin is going to work on receptors that are called B2 receptors. It's going to work there. B2 receptors, when they work on, they are present on the cells, that in turn, B2 receptor stimulation in turn causes the nitric oxide production, that causes the PGI2 production and EDHF production. So if we can block B2, then we can block the effect of bradykinin. And there is a drug for that. And actually, there are many drugs for that. So one such drug is Icatibant. So Icatibant has been used for hereditary angioedema. What does that mean? In some people, they have a problem that they respond to bradykinin more. And so they, by inheritance, by genetics, their blood vessels stay dilated and they keep getting fluids to come out of the blood vessels because of the bradykinin's effect or because of the dilated blood vessels, and they have all the effects of dilated blood vessels and edema. So what they do is this Icatibant allows the B2 receptors for bradykinin to be blocked, which in turn causes the blood vessels not to be dilated and kind of help with the angioedema that these patients suffer. Now they tried the same thing in the SARS-CoV-2 patients. So in the SARS-CoV-2 patients, they gave Icatibant to see if they can block the bradykinin, what would happen. Now, there is one more thing before I go and talk about the results. Somebody had asked me this question, that if we are giving ACE inhibitors or angiotensin inhibitors, that is ACE enzyme inhibitors, will that not cause bradykinin to increase? And that is correct. Because once you have the ACE inhibitors and ACE inhibitors are blocking this part, now bradykinin that needs to be neutralized by ACE enzyme is not going to be neutralized, and that can cause bradykinin storm. So in such case, that means patients who may be moving from ACE inhibitors towards the bradykinin storm may be given Icatibant to block the bradykinin storm. So I really, really love this. All of the topics today, the nasal spray, that gives us the booster for the innate arm to look like a child's innate arm, which is awesome. The discussion of the zinc ionophore with the EGCG, that I love. And then over here, the ACE enzyme, if somebody is on ACE inhibitors, they can take Icatibant if needed, if they have a inclination, if their body is moving towards hypoxia or oxygen, drop in oxygen saturation. So Icatibant is something that may be very, very useful for them. So I think that all these topics are very interesting. I'm going to now share the results. Here is what they did. So very small study. They had taken 9 cases who were hospitalized, 9 patients of SARS-CoV-2 or COVID-19. They were hospitalized, they were on oxygen, mechanical ventilation, not ventilation, but they were on oxygen. Then there were 18 controls as well. So they gave them Icatibant to 9 people, and what happened was all 9 of them so look at this, overall in 8 of 9 patients treated with Icatibant, a reduction of 3 liters per minute in oxygen supplementation or greater after 24 hours was observed. Of 18 matched control, only 3, that is 17%, showed a spontaneous reduction in oxygen need. So in controls who are not getting Bradykinin B2 Receptor Antagonist, these folks, only 17% developed automatic reduction, meaning they started recovering automatically. But in case of 9 patients who were given Icatibant, they saw 89% started not needing oxygen within 24 hours. So that is a significant result. So this is the discussion for today. Sorry, I was a little distracted as well, or a little upset with that post. Whoever wrote that post and caused damage to people, I was upset about it. So that is the discussion. Please like, subscribe, and share. And I would see you again tomorrow. If you have any questions, please send them to me. And if you wanted to donate to support my work, there is a link in the description where you can support me. Thank you very much, and stay safe and protected, and see you tomorrow.